So Casey, I mentioned that with more blood transfusions, patients tend to accumulate iron. Can you talk a little bit more about how we look for that and what we do about it?
Yes, so it's very important to use a screening tool to try to ascertain whether the body is accumulating a lot of iron after blood transfusions. The most commonly used tool is a blood test called the ferritin, and this gives us a sense of how much iron is being stored in the body. There are some conditions such as infection or inflammation that can raise the ferritin somewhat artificially, so it can't be used in all situations, but it's a good marker for patients who are going along, feeling their usual baseline and receiving transfusions regularly. Once the ferritin is above 1,000, multiple guidelines recommend that patients really should be offered what's called chelation therapy to try to remove the iron from their system. Unfortunately, our bodies were not made with any natural way of getting rid of iron other than bleeding. So these medications are able to pull iron out of the system. They're taken orally and generally are quite effective over a long period of time at holding back the ongoing increase in iron accumulation in the body. So once iron accumulates, we worry that free iron will get into some of the organs in the body, such as the liver. And we also worry that bacteria and other pathogens like iron, and so there may be a concern over the long haul about an increased risk of infection, especially in patients who go on to have an allogeneic stem cell transplant as treatment for their MDS or for AML. So I am an advocate for trying to be aggressive about iron chelation. Of course, like any medication, these medications can have some toxicities. Patients may have abdominal discomfort, diarrhea even. And so if there is significant negative impact on quality of life, then sometimes we have to forego these medications. But if the patients can tolerate them, I do think it's an important part of our arsenal in the overall care of our low-risk MDS patients.
I actually had iron deficiency as a teenager. Because my madre was a vegetarian, or is vegetarian. Either way, Stinky Space Nuts, Marquis Des Meow. Thank you, welcome back. Alright, very good there. No further links. You're